Welcome back and thank you for staying with us. Now we move to Nigeria's North Central, where Senator Natasha Akpoti-Uduaghan has raised concerns over primary health care neglect in Kogi Central. Senator Akpoti-Uduaghan, representing Kogi Central, urged the government for more primary health care centers to tackle child mortality. Now, speaking at a Senate Committee on Health session in Abuja, she highlighted the need for specialized rural maternal care facilities.
I'd like this distinguished House to know that Kogi Central have been greatly neglected and cut off from governance, especially in terms of...
Now, to further discuss this, I am being joined by the Commissioner for Health in Kogi State, Dr. Usman Zakari. Good afternoon, and thank you so much for joining me, Doctor.
Good afternoon, and thank you for having me.
All right, so could you share your insights on the statement made by Senator Natasha regarding the state of primary health care in Kogi Central or even in Kogi as a whole?
Okay, first of all, I want to thank you for the opportunity to give a little clarification. I would say that Senator Natasha, despite her interest in the healthcare delivery system, particularly the primary healthcare delivery system, I think she speaks from a point of ignorance, so to say. Yes, in times past, our primary healthcare were in terrible state, but I would say that, with the advent of, with coming in, of this administration in Kogi State, and of course, with the basic healthcare provision fund from the National Primary Care Development Agency and, the Federal Ministry of Health, a lot has changed. So much has changed to the fact that, as a matter of fact, one of the places that have the best of primary healthcare delivery system in Kogi State is Kogi Central. First of all, there are about 873 primary healthcare centers in Kogi State. Out of these, utilizing the basic healthcare provision fund, the state has been able to upgrade, renovate, and bring about 239 primary health care up to standard. Of these 239 that have been renovated, they are fully equipped to provide basic health care at the primary health care level. And there is also the employment of over 80 midwives who have never had it this good. Over 80 midwives. Of these 80, 26 of them are in the North Central. Of all of these 239 facilities I mentioned earlier, 56 of them are in the North Central. And before the advent of basic healthcare provision fund, our facilities were not in, some of our facilities were just dilapidated. There were no human resources for health. But with the advent of the basic healthcare provision fund, over 250 healthcare workers to provide skilled bed attendants have already been employed in our primary healthcare centers. Beyond that, there have been a lot of individual and government efforts, apart from providing the leadership and governance coordination platform, enabling law, setting up the State Primary Healthcare Development Agency, appointing an active and effective executive director, putting in place a governing board for the primary healthcare. All of these have prepared the grounds for fantastic intervention in the healthcare delivery system. And beyond that, this government has done a lot of renovation across the board. As a matter of fact, beyond just the government, the wife of His Excellency Barrister Amina Bello recently renovated 2 facilities. The incoming governor of Kogi State, Alhaji Ahmed Usman built and donated a health facility. So since the creation of primary health care, I think the second best thing that has happened to us in the primary health care is the basic healthcare provision fund. And of course, between 2016 and now, that the governor has led the state there's been significant improvement in terms of human resources for health, in terms of health infrastructure, healthcare financing. As I speak with you right now, beyond the 15% declaration, Abuja declaration, where heads of African governments committed to, allocate 15% of the budgetary allocation to health. As at last budget, we did 16%, and we're poised to do more this time.
All right.
So I think, yes, she's crushed.
It's actually quite a wonder, if it's quite a wonder when she heard talking about the state of the healthcare system in Kogi State, despite all the successes that you have listed that has been recorded. Now, just to back up what she said, there was an investigation done, and it actually says that about 25% of Nigerian primary healthcare systems, are only 25% of those healthcare systems are functioning. So are you saying that Kogi State, takes most of the share in this 25%?
Okay, no, that's not exactly what I'm saying. What I meant was that between when this government came on board, and when I say this government now, I'm talking about between 2016 and now, when His Excellency Alhaji Yaya Bello came on board, and the current, the previous government of Buhari and the current government of His Excellency Bola Ahmed Tinubu, a whole lot has happened in the primary healthcare, such that rather than criticism and rather than painting a gloomy picture, we should be commending and appreciating the significant leap. For example, as at the time we came on board, vaccine coverage for Kogi State, especially that 3 was at 36%. As I speak with you, we're at 72%. As at the time we came on board in 2016, most of the primary healthcare centers had no nurse midwives in any of the facilities. We have over 80 of them right now. These facilities, because of the funds that are given to them through the Basic Healthcare Provision Fund, have also been able to employ junior to mid-level healthcare professionals, about 250 of them across board. So, and like I just mentioned, about 239 primary healthcare without with funding from Basic Healthcare Provision Fund has been upgraded, equipment have been supplied for them. Some of them even have, have even gone far to begin to document using electronic medium. All the 239 have laptops where they keep the records. All the 239 have clinical services items. In times past, you will not find a manometer. You will not find a stethoscope.
All right, Doctor. Now, while you were speaking, you did talk about the improvement in human resources and employment of a number of healthcare workers. What I want to know is there's been reports of mass exodus and also brain drain in the healthcare sector. Now, are you saying it has no effect, or it didn't affect Kogi State in any way, or even the operations of these healthcare centers?
There is no state that is isolated or licensed from, what is happening now about the brain drain, what is regarded in other parlance as the Jackpot syndrome. Yes. A lot of healthcare professionals have left the shores of this country. Kogi State has had its own fair share. But when you talk about, it's more of, the real technical healthcare professionals, largely doctors, pharmacists, and nurses that have left in those numbers. At the level of the primary healthcare, there are some other persons that provide that basic life savings interventions. There are community health extension workers, there are junior community health extension workers, there are community health officers, and in recent time, we have also been able to add nurses and midwives across board. Yes, we have had our fair share, but again, we also have system in place that mitigates the effect of some of these exodus. One of them is the payment of full comments to our healthcare professionals. Another one is the fact that currently the hazard allowance that the federal government has been paying even though a little modified. The state has also domesticated it, not 100%, but in the last salary that they received, hazard allowance has already been paid for them. Okay. And there are ongoing discussions with all the professional bodies on what can create that enabling environment for our healthcare professionals to continue to provide that level of service.
All right. Well,
yes, we have had our fair share, but we're not as affected as other states.
All right. Well, thank you so much,
yes.
Commissioner, for joining me on the news to discuss this. And it's a good thing to know that, Kogi State has not been affected as other states in, all the challenges that's been faced in the health sector.
Thank you so much. Thank you. Thank you for having me.